We've seen concerts being canceled. Big tennis tournament canceled. The parade gets canceled. What's next in this? I mean, people have, talked about whether we would see professional sports teams play in empty arenas, whether large public. We're just getting into the spring. Summer months are coming. There's going to be festivals that are going to be happening across the country and around the world. Are they on the chopping block as well?
They may be, and that worries me. I mean, from a personal level, I'm an avid sports fan, and I went to the Raptors game a week ago. I was at the 9:05 game yesterday with a good friend of mine, and the crowd was pretty thin. And I do wonder if we're going to see the possibility of movie theaters closing. Are we going to see every sporting event being played in front of nobody? I do wonder if the reasonability of that. I understand the reaction from organizers and from owners of sports franchises that they don't want to see irreparable harm associated with their product. I do wonder if it is a bit overkill at this point in time.
So let me stop you there. You're an infectious disease specialist.
Correct.
You use the word overkill. People would say that you cancel these events because you're going to have, to your point, thousands of people in the same space, a range of different levels of immunity. Some people might have a compromised immune system. Why doesn't it make sense to temporarily shut these things down so that people aren't all there in that same area?
I think the concept makes sense, but I think we have to examine the specifics of each particular event. And that's why I think it was particularly helpful for the Public Health Agency of Canada to put out this decision-making tool and guideline. I think it's very logical and makes sense to think about exactly how big is the event. Is it an indoor event or an outdoor event? What's the age range of the people that are going to be there? What's the situation in terms of hand washing facilities and dispensers that are available there? Is there a possibility of perhaps staggering entrances and exits so that you don't have swarms of people entering and exiting the facility at the same time? These are questions that I think need to be answered, and maybe we need to go through a trial period where we see what works and what doesn't. But I don't know where you draw the line.